Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeopathic Remedies for Sterility. What is sterility? Sterility is the physiological inability to produce a child by a couple. Another term, infertility, should be discussed here, which means inability to complete a full-term pregnancy and give birth to a healthy baby. One has to exert one's acumen to differentiate between these two. I leave it to my respective viewers. What are the causes of sterility? Production of unhealthy sperm by males, production of less number of sperm per ejaculation by males, suffering from severe diseases like TB, cancer, both sex, ovulation disorder in women, malformation of reproductive system in both, primary ovarian insufficiency, endometriosis in women, pelvic adhesion in women, cancer treatment, irradiation of pelvic area, both sex, use of addiction, both sex, uterine fibroid, due to some medicines, both sex, cervical mucus, irradiation of pelvic area, also both sex. What is the incidence of sterility in India? About 15 to 20 million persons suffer from sterility in India every year, and it is about 15% of eligible couples. Because we are discussing about sterility, so only number of couples have been taken into account. What are signs, symptoms of sterility? Getting not pregnant, irregular menstrual period, immature or unhealthy production of ovum, failure of production of adequate sperm by male person. How a case of sterility should be investigated? Investigation always start with a checkup of the male member. The following tests are performed to know the status of the male: scrotal ultrasound, transrectal ultrasound, hormone testing, post-ejaculation urine analysis, testicular biopsy, genetic test, specialized sperm function test. All the tests are done to look into whether the scrotum and all other hormones and all other things which are associated with this sterility matter is okay, or there is some trouble, such as say in the testicular biopsy. In testicular biopsy, it is seen whether the testis and the cells of the testis are functioning correctly. Post ejaculation test, whether the post ejaculation urine analysis test, whether it is seen whether this ejaculation is properly channelized through urethra, into the orifice of the urethra. Hormone testing, whether necessary hormones are there in the semen. These are tested, and these are everything is for to know the status of the male member. This image is production of ovum, how the ovum is produced and is moving into the fallopian tube, that has been shown. And here the production of sperms. The sperms are produced here, then it is going to this way, from this side, this is going to this side, and there it is urethral passage and it's coming out of the orifice, the semen, including sperms. Semen, actually the whole fluid, sperms are floating there. For female, following are looked into: polycystic ovarian syndrome, that is whether there is polycystic ovarian syndrome in the women or not, checked. Hypothalamic dysfunction, whether it is there or not. Primary ovarian insufficiency, the same. Too much production of prolactin, Actually, too much production of protein always interferes with this sterility problem. Problems of fallopian tube, naturally these organic things. Endometriosis is a very severe type of disease which often leads to sterility of women. Uterine cervical causes, there is organic causes. Unexplained sterility, that is very difficult to diagnose unexplained. In case of unexplained sterility, it is very difficult to pinpoint the trouble and positive effect, positive results often not received. How cases of sterility are managed? Organic problem of male, then the same of female are checked. Always first problems of problem of the male person is checked. Now problem are of two types, organic trouble and functional. Organic means whether there any organ, means the physical part of the body, such as in case of male testes, the tubes, various tubes. In case of female, every organ of the genital system, starting from ovary, fallopian tube, uterus, everything. These are checked for its patency, whether this the all organs are patent or there is existing and functioning correctly, and whether there is any functional problem, that is also checked then after that. How sterility can be prevented? This is a very difficult thing. Some suggestions actually given: quit all sorts of addiction, eat balanced diet, maintain healthy weight, that is body weight, take regular physical exercises, undertake medical checkup at least once a year. Discussions about treatment of sterility with homeopathic remedies. Borax for sterility. Persons suffer from so serious leukorrhea that the same interferes with insemination of ovum with the sperm. Here persons means women. Helonius for sterility. Excessive bleeding, ulcer around cervix of uterus, displaced uterus, no power to perform sex or no desire to sex. These are also related to women. Iodine for sterility. Breast dry up, hang up like pieces of skin, patients emaciate despite taking regular foods in sufficient quantity. Also related to the ladies. Conium for sterility. Both breast tenders, menses scanty, ovaries dry up, vertigo, suppressed sexual desire. Same thing also for the symptoms are for the ladies only. Lachesis for sterility. Left ovary swollen, indurated, so painful that touch of cloth is unbearable. Menses black, scanty, lumpy, acrid. Vicarious from nose. That is vicarious menstruation from nose. You know, vicarious menstruation means when the time of menses appear, the mens doesn't come out of uterus or vagina, rather it comes out from other opening of the body, from nose, from mouth, from eyes, from ears. These are called vicarious menstruation. This happens actually, but seldom. Uterine and ovarian pain better from flow of blood, mammae inflamed, bluish, nipples swollen, inflamed, erect, painful to touch, nymphomania. Nymphomania means too much sexual desire. Climacteric trouble, painful flashes of heat, copious, smarting, stiffening linen type leukorrhea. These are actually related to lachesis only. Climacteric troubles, actually this you can ignore this particular term here, because climacteric trouble means when the patient, when the woman is in the stage of menstruation being ceased permanently. That is climacteric period. Now we are discussing sterility in normal time, not climacteric period. Naxpham for sterility. Multiple sclerosis. So sclerosis হয়ে আছে